So what are symptoms of multiple sclerosis? When you think of MS as a process that affects the brain and spinal cord, ultimately everything in our body is influenced by the brain and spinal cord, so it's not unusual that there are a lot of different symptoms that MS can present with. Traditionally, we look for symptoms that neurological symptoms that would come and either get better completely or stabilize as characteristic of relapses. When you look at what typical relapse symptoms would be, the most common relapse symptom would be something sensory. So the person might have numbness or tingling in an arm, a leg, a whole half a body, and then maybe it's going to stabilize with or without treatment, or maybe even go away completely. That is part of the reason there can be a lag in the time from when symptoms start to when they go away. If you're a young, healthy, active person, you've got a busy life, if you woke up with a little numbness in a leg, you probably could think of 100 reasons why that might be there. Maybe you've started a new workout regimen, or maybe you rode in the car for a long time. And if it goes away, you're probably just going to write it off and forget about it. There are other symptoms that we see with MS. Motor problems, meaning muscle problems. We could see weakness or incoordination. We can see visual changes. Optic neuritis, or loss of vision in one eye, is seen in about 70% of people with MS at some point in the course of their MS. Those numbers are probably changing as we get more aggressive with therapy, but certainly visual changes are not uncommon in multiple sclerosis. There are some symptoms that we probably have really under-recognized in multiple sclerosis. Pain would be one of those. For years in textbooks in medical school, MS was said to be a painless condition. We know now that 70% of people with MS have some form of discomfort directly related to their MS. This might be hypersensitivity to touch in an area where sensation has been affected. It might be painful muscle spasms. It might be some sort of facial or head pain called neuralgias. So pain is something that we do see in MS. Cognitive dysfunction, memory loss, is also something that has been under-recognized in multiple sclerosis. We take cognitive dysfunction very seriously because it is the #1 reason why someone might leave the workplace due to their MS. We don't want that to happen. We want people with MS to be able to do everything that everyone else is, both at home and at work. Most of our jobs nowadays are less physical than they were, say, 50 years ago, and many of us, if you had to, could probably do our job from a wheelchair. Very few jobs, though, can accommodate memory loss, and so that's something that we do try to watch for. If someone asked what the #1 symptom is with multiple sclerosis, far and away it would be fatigue. 90% of people with MS do have some form of fatigue. And fatigue is another one of these words that probably is excessively vague for the purposes of what it really is in MS. If you go to your family members, or you went to a doctor's waiting room and you asked how many people here have fatigue from time to time, well, everyone's going to raise their hands. We all have bad days, or maybe we're a little sleep deprived, or burning the candle at both ends. But true MS fatigue is usually another level of intensity versus just run-of-the-mill tiredness. The most common type of fatigue we see in MS is lassitude, and that's the sudden overwhelming sense of just, I can't go any further. It's not related to exertion or what you're doing, it just comes on out of the blue. Some people have described it as like you're trying to swim with a fur coat on, or like you're lying with a lead blanket covering you. Nerve fiber fatigue is the other common type of fatigue we see in MS, and this is an electrical phenomenon. Those nerve fibers that have been stripped of their insulation, of their myelin, still work. They just don't work as efficiently as they did before. And if you use that nerve fiber again and again and again, like with exercise, or if you raise your core body temperature, like getting outside when it's hot, or sitting in a hot tub, you can make that nerve fiber stop working for a time and bring on symptoms. This is not dangerous. We don't want to send the message that people with MS shouldn't exercise. In fact, the opposite. We know people with MS do better in the long run if they are in a regular fitness program. But sometimes people with MS have to learn what the boundaries are, that if you're say on a treadmill and your feet start getting tingly after 15 minutes, you might want to take a break and cool off. Exercising with a cooling vest or in a cool pool can actually improve the amount of time that someone can keep going with whatever form of exercise that is. Lastly, some of the symptoms that are maybe not under-recognized but are under-reported would be bowel and bladder problems and sexual dysfunction. These are symptoms sometimes that people are just embarrassed to bring up. Interestingly, studies have shown that if you do bring it up, if it's an issue for you, your doctor or nurse is completely comfortable talking about it. They just might not be the first one to bring it up because they're human and they have their own comfort levels with talking about those things. But those obviously can affect quality of life significantly. And if it is an issue, put it on the table.